You know, I always tell folks we are so lucky here in Western Washington because we have so many amazing healthcare options. And this morning we're talking about brain health with the Eastside Neuroscience Institute, which is actually a joint venture between Overlake and EvergreenHealth. Their neurosurgeon, Dr. Amitoz Manhas, joins me now. It is good to see you again.
Yeah, thanks for having me.
So let's talk about the Eastside Neuroscience Institute. What is all happening there?
So the Eastside Neuroscience Institute is something that's come together over the last couple of years, and we're very proud of what we've been able to accomplish. It's essentially a joint venture between two hospital systems, Overlake and EvergreenHealth. And so with the shared vision of high-quality, patient-centered neuroscience care, we're able to provide comprehensive care with the outstanding providers we have in our collective systems.
And when you think about the resources when these two hospitals join together, it's like a super force.
That's right.
I have to ask, let's talk about what exactly a benign cranial tumor is and how it's caused.
So benign tumors are some of the most common tumors that we see, whether we do surgery or not. We will see these patients in clinic or in the hospital to discuss treatment options depending upon symptoms that they're having or signs that they're exhibiting. We may or may not intervene, but it's the most common type of brain mass that we see. Let's
talk about those signs and symptoms. What would some of them be?
Well, it could be something as simple as a headache that might be getting gradually worse, or it could be more serious, like a seizure or weakness, difficulty with coordination, sensation, difficulty with speech. There's all sorts of different presentations that we see as a result of these tumors.
That's fascinating because someone could almost think these are stroke-like symptoms when they could be something completely different. So how do they get diagnosed?
So typically it's through imaging. It's usually a CT scan, often an MRI to look more closely at the soft tissue components of the brain. So it's a combination of imaging and the physical exam, obviously.
So let's say you come in and you find that you have this benign cranial tumor. You said that sometimes you touch them and sometimes you don't. Is there kind of a treatment plan for all of them?
Absolutely. So a lot of it depends upon if they're incidental findings. So a lot of times with our aging population and in general, patients present after falls from standing, traumatic injuries, TIAs or strokes. There's different reasons why patients might be imaged to, where a mass might be found.
Right.
But if they are really starting to have neurological symptoms, then we have to come together with a plan to treat those tumors.
Because you need to have action on that.
Right.
How can someone, let's say, and I like to ask this question because I feel like sometimes I'm very sensitive. I'm like, what's happening to my body? And I know some folks out there as well. Let's just say you feel like something's off. Where do you start to get to the Neuroscience Institute? Like, what's the first step?
Well, first, you should have a primary care doctor. You should be plugged into a healthcare system, and we are welcome. We welcome all kinds of patients to either call us directly, but it certainly is good to first have a PCP or primary care doctor. But if you start having some of these concerning symptoms like I described, you need to present to the emergency room or urgent care, and certainly let someone know who's a healthcare provider to help direct the the care. So,
yeah. How awesome is it that we have this Neuroscience Institute?
I am very excited. I mean, it's been something that's been in the works for the last couple of years. We've been becoming more and more involved in the community that we're serving, and also taking in all kinds of patients from around the Puget Sound, Northwest.
I'm sure all over the Northwest region. I'm sure you get people from Idaho, all over.
It's true, yeah.
So how can we learn more about benign cranial tumors overall?
So we have a website, overlakehospital.org. We also have eastsidneuroscienceinstitute.org, where you can go and look up the providers that we have in our program and the types of conditions that we treat. But it's very easy to find us online.
Dr. Manhas, thank you so much for all your time and for explaining all this, and I am sure it's going to help so many people. And again, if you want to learn more about what we talked about this morning, please visit the website on your screen, eastsidneuroinstitute.org.